We trained you to stay and work a cardiac arrest on scene, to identify obvious death, to know when to terminate resuscitation efforts. But it's entirely possible that nobody ever told you anything about how to communicate the worst news of someone's entire life. So let's talk about that on this episode of One for the Road. You've heard me tell you that the best place to work a cardiac arrest is right there on scene, wherever you found the patient. You've heard me say that you should continue those efforts for as long as is necessary without scooping up the patient and rushing off to the hospital. And this is true even for our pediatric patients, especially for our pediatric patients. But we haven't talked about the fact that these policies are going to place you in a position to notify family or loved ones on scene that the patient has died and that we've ceased resuscitation efforts. It's almost universally agreed that our training and death notification is woefully inadequate. So here's a few tips for how to approach that very delicate moment. First, before you decide to begin notifying the family that the patient has died, make sure you know the patient's name. When you're certain you have the correct name, gather the family members who are present in the same room together. You don't want to have to go through this twice. Allow them to hear the news at the same time. If some of the family are children, allow the parents to decide if those children should stay. That decision should be up to them. Begin by identifying yourself and confirm that everyone present is aware of why you were called to the scene. This is a good time to call the patient by name. We were called today because Margie collapsed in the hallway. Continue with a brief explanation of what you have done so far and use simple terms. Don't get technical. We found that Margie wasn't breathing and her heart wasn't beating regularly. We placed a breathing tube and performed CPR. We also attempted to restart her heart with electricity and medications, just as they would have done at the hospital. Now it's time to deliver the hard news. Do this without using uncertain terms. However you say this, make sure you say the words died or dead. Don't use passed away or has left us or anything that's open to interpretation. Unfortunately, none of those efforts has been successful, and Marjorie has died. We've consulted with our physician at the emergency room, and she also agrees. We're going to stop our resuscitation efforts now. Once you've said that in a non-ambiguous way, in non-ambiguous terms, this part is important, be silent. Allow those words to carry their weight. Allow them the time that they need to be heard. Sometimes in our own awkward nervousness, we feel like we just want to fill every moment of silence with something. Don't do it. Let them take the lead from this point. From here, things can go many different ways. You may want to consider helping the family get in touch with their support network, whether that be clergy or grief counseling or other family and friends. You can also encourage goodbyes. If you feel like people want time to be present with their loved one who has died, coordinate that with your local law enforcement partners on scene and find out if that's okay, and perhaps facilitate that happening. Keep in mind that it's not your role to fix their grief. They're going to be devastated and they're going to grieve in their own way. Be present in their grief without trying to counsel or cheer them up. You're not trained in grief counseling. Those efforts usually end up sounding hollow. It's okay to say things like, I can't imagine how difficult this is for you, or I'm sorry for your loss, and ask, how can I help? In these moments, we need to recognize that our care needs to shift from the patient to the family. It will never be easy, but I hope these guidelines help. I appreciate you watching. I'm Steve Whitehead, and that is One for the Road.